ఎపియాన్ పెయిన్ మేనేజ్మెంట్ సెంటర్. ఇక్కడ మీ నొప్పులు శాశ్వతం కావు.
A young male of 35 years came to me and he was having severe back pain, especially when he was driving his bike. And he had to drive his bike almost for 15 to 20 kilometers every day, up and down. So that was around 30 kilometers. So he had this back pain which was there in the back only, and it was not radiating to the legs, and it was more while he was bending and more while he was turning on his sides. And when he wants to pick up something from down, he used to get severe back pain. So we examined him and then we advised him for a MRI, and the MRI showed that there is nothing significant damage that is happening inside. The discs are at proper places, the discs are well hydrated, the other structures around is all good. But then we again examined him once more because the patient was having severe excruciating back pain, and then we asked him for a X-ray. Now most of the time we know that for any back pain, MRI, the sensitivity and specificity of MRI is very high. But sometimes certain conditions like a facet joint problem can be missed in MRI. And so when we want to see the bones that forms the facet joint, the best would be getting an X-ray done. And when we got the X-ray done, because we suspected a few findings on examination, we saw that his facet joints are completely degenerated. Now these changes usually happen in old age, but a case of young boy coming with facet joint pain or a facet joint degeneration is not so uncommon, because we understood that his daily activities was to drive long hours, especially in two-wheeler with bending forward, and his job of lifting heavy weights throughout the day, which he has been doing since last 1 decade. So facet joint is one condition where the small joints are formed between the two vertebrae of your spine bone, and these facet joints are very important to maintain the stability of your spine, and it also gives mobility to the joint when you want to turn sideways and you want to bend forward and bend backward. So now this facet joint examination was done by our team, and then we understood that this patient has facet joint degeneration. So we asked him for a small injection treatment, and with the injection treatment using his own blood, it took around 21 days to 45 days where the complete recovery was done. Then we taught him certain exercises, certain lifestyle modifications, specific exercises for his facet joints, some weight reduction, lifestyle modification, and on 3rd month of review he was completely pain free. Now facet joint is, like I said, is not so uncommon, but treating it properly is very important. And where you go and which center you go, whom you meet, which doctor you are getting treated is also very important. Now Epion Pain Management Center has been practicing and these conditions, treating it by identifying properly. We don't treat the MRI, we treat the patient's symptoms, we identify what is the problem, correlate with certain examinations, make a proper diagnosis, and give a permanent solution to all kind of back pain or any kind of chronic pain. We have a team of doctors who will evaluate the patient again and again, a team of rehab specialists, a team of occupational therapists, and here whatever treatment we do is all using the high-end machines according to FDA guidelines, according to the scientific basis and the protocol. So we have treated more than 50,000 patients of such pain, chronic pain, with very good success rate of more than 90%. So if you have facet joint pain, do choose the best center so you get the best result.